Thank you, Ceann Comhairle. Minister, last Friday, the CEO of the HSE directed a severe escalation in the recruitment embargo caused by this government's mismanagement of the health budget. Job offers were withdrawn and recruitment has been halted for thousands of vital frontline posts. More than 7,000 essential posts have now been scrapped. The disastrous decision and consequences of this government's decision to deliberately underfund the health services for next year becomes clearer by the day and by the week. In his memo last week, the HSE CEO Bernard Gloucester wrote, and I quote, "I know this will create difficulties for many of you, as the health service faces an enormous increase in demand." On budget week, Minister, he wrote to the Minister for Health outlining that, and I quote, "circa three-quarters of the deficit cannot be achieved by way of reduction without significant and punitive risks to the public." Minister, yesterday the Irish Nurses and Midwives Organisation recorded 595 patients on hospital trolleys. It is in this context, as we head into what we all want to avoid, but what I think is unavoidable, is an extremely difficult winter in our health services. And your government, in that context, has decided to deliberately underfund the health service. In plain terms, it means no more experienced nurses and healthcare assistants can be hired, despite hundreds of patients on trolleys and hundreds of thousands of people on waiting lists. It means no more psychologists for CAMHS, even though the number of children on waiting lists has doubled under your government's watch. No more home care workers, even though 5,000 older people are waiting for home support. No more therapists for specialist discharge teams. No more radiographers or clerical staff for radiology departments, despite nearly 250,000 people waiting for a diagnostic scan. No more porters or hygienists or cleaners to keep patients safe from infections. No more investment in community care to deliver early intervention, chronic disease management or local rehabilitation services. And this is despite the fact that you know and I know that without all of those supports, people will not get the right care in the right place at the right time. That is not to mention, Minister, the extreme reputational damage that this recruitment freeze has caused for the health service. The only exemptions here are approved consultant posts, a small number of doctor training posts and nurses and midwives who are graduating this year. What about all of those Irish nurses, Minister, who are working abroad, who we want to come home and some want to come home? What about all of the other healthcare professionals who are graduating this year? What message have you sent them? I'll tell you, Minister, you have told them to leave if they are thinking about it, and if you have left, we don't want you, stay where you are. You have said to Australia, to Canada, to Britain and to New Zealand, come and take our healthcare graduates. And what message does that send at a time of great crisis in the health service, when hundreds of patients are on hospital trolleys every single day, when hundreds of thousands of people cannot get access to basic care? Will children with scoliosis, who you promised, Minister, would be seen within 4 months, and that was another broken promise by you and this government, are left without any clarity on when they will get the life-changing care that they deserve? It was quite obvious from the budget that your government has thrown in the towel on health. You have condemned tens of thousands of patients and staff to extreme risk in hospitals this winter. So, Minister, my questions to you are, will your government wake up, see sense and undo your disastrous decision to underfund the health service? Will you immediately revise the health budget for the rest of this year and of 2024? And will you reverse the recruitment embargo and the scrapping of essential frontline posts that will do enormous damage to patients?
Well, thanks very much, Ceann Comhairle, and thank you to Deputy Cullinane for raising the very important issue in relation to our health service and how we ensure that we continue to grow the size of our health service, to hire more nurses, more doctors and more people to work at the front line. I do think it's very important when you talk about the health service, when any of us talk about the health service and recruitment levels, that we both give a little bit of context and a little bit of honesty in relation to the discussion. The first thing to say is, when we're talking about the level of recruitment in the Irish Health Service, we now have, as of September, 143,075 staff working in the Irish Health Service, and that is an increase of 5,330 this year to date. So sometimes when you hear Sinn Féin and others, you get the impression that we're contracting or reducing the size of the health service. Over 5,330 more people working in the Irish Health Service this year so far compared to last year. We've now seen 23,263 more people working in the health service since the beginning of 2020, just before this government came to office. And included in that is 6,808 more nurses and midwives, 3,388 more health and social care professionals, including therapists, and 2,633 more doctors and dentists. 2020, 2021, 2022. What were those 3 years? They were the 3 years in which we saw the largest increase ever in the workforces of the HSE since its foundation. So we do need a little bit of context. Similarly, when it came to the budget only a month ago, the Minister for Health has also secured funding to further grow the size of the health service workforce in 2024, and he has funding to increase by 2,268 the number of people working in the Irish Health Service next year as well. Now, you are right. As of the 10th of November, the HSE CEO did, as you say, issue a pause on recruitment. There were a number of exemptions, some of which you glossed over, exemptions in relation to consultants, in relation to graduate nurses, in relation to midwives, and in relation to doctors in formal training programmes. And the Minister for Health is supportive of this because there does need to be some link between the budget that we allocate in this House and actually what happens in relation to a public service. The reality of the situation is the HSE is now on course to exceed the 2023 funded workforce target. But let me be very clear, this is for 2023. We have budget 2024. We have the 1st of January weeks away. And that is a year in which the Minister for Health has more money for the HSE to hire more nurses, more doctors, in addition to the exemptions that have already been secured. Now, when it comes to honesty, honesty is important in politics, and honesty is definitely important when it comes to the health service. And I have here 2 documents. This is the budget book. And in the budget book, on page 104 and 105, the government outlined its allocation of funding for the health service for 2024, Ceann Comhairle. €2 billion. €2 billion, broken down between core funding, non-core funding and capital. I have here, and you'll be glad to know I read it, I have here the Sinn Féin Alternative Budget for Health 2024, presumably what you'd do if you were Minister for Health, €1.5 billion. So when you ask me to revise the health budget, are you asking me to cut the health budget by a further £500 million to reflect your policy plans?
David Cullinane.
Well, the Minister can raise issues about Sinn Féin all he likes, and what he does there is, of course, he doesn't include in it that we would have provided for existing levels of service above that 1.5 billion. So first of all, the Minister is wrong, as usual. But people don't need bluster, Minister. I want you to talk to patients, and I want you to talk to healthcare professionals. The older person, the grandmother, will be lying in a hospital trolley. The person with scoliosis waiting for a procedure. A child who is waiting for speech or language therapy or occupational therapy. All of these things are going to get worse because there is now a recruitment freeze, and worse than that, and you call it a pause, 7,000 people have had the rug pulled from under them because the posts that they were offered have been scrapped because of a decision that you and all of your colleagues took to underfund the health service. And what about those people who are working in the healthcare services in New Zealand, Australia, Britain, Canada, who want to come home? That pause means they can't come home, Minister. It means you're telling them to stay where they are when we need them most. So I'm asking you again to stop making this about Sinn Féin. You and your government made the decision. Reverse the decision, reverse that disastrous recruitment embargo, and do what's right for those patients I've spoken about and those people who want to come home and work in the public system.
Minister, please.
Oh, get over yourself. I'm not making this about Sinn Féin at all. I'm making it about choices and the choices the Irish people have in relation to this government versus that government. And those choices are very, very clear. You don't have to take my word for it on what the Sinn Féin Alternative Health Budget was. Your leader said it on RT this week, on Sunday. Now, don't sue me, but she did say it. She said it there. She said it there. She's hardly wrong. She's hardly wrong. She, one point, no, she...
Please let the Minister answer.
They tend to shout at you or sue you, so stop. Look, elections and politics and accountability are about making choices. And the people of Ireland will have a choice. And they'll have a choice between a government that is continuing to grow the size of the health service. And what I say to those patients is very clear. We're offering €2 billion in additional health spending. But what I ask you, as somebody who wishes to be the Minister for Health, from somebody who was the Minister for Health, is it your position that you can just spend and recruit regardless of budget? Or does what you actually produce or what we produce on budget day matter? And if it does, then it's time to be honest. We're increasing the size of the health service, we're increasing the budget, we're going to make more progress in relation to patient outcomes in 2024, but there has to be some link.
Thank you, Minister.